New videos every day.
Hi, my name is Dr. Vanessa Fritz. I'm a naturopathic doctor and licensed acupuncturist. I'd like to talk to you a little bit about what is naturopathic medicine. Many people aren't aware that such a thing exists. First of all, the education of a naturopathic doctor is one where we go to a 4-year medical school, and the first couple of years of medical school are the same as any standard medical school in the United States. However, the philosophy with which we treat our patients is very different. What we try to do is use therapies that help the body heal itself. The body has an infinite wisdom, and I think we just don't know everything that there is to know about how the human body works yet. And so therapies that are very gentle, that help stimulate the body's own innate healing mechanisms, we believe are preferable to very strong pharmaceutical treatments. Having said that, it is important to realize that there are pharmaceutical treatments that can actually be life-saving. So it's not that we're against that, but it's not the first recourse that we believe should be used in most cases. Naturopathic medicine, so firstly, is about not doing any harm. Second of all, what we want to do is we want to treat the cause. And so a lot of times what we're doing is just palliating symptoms. And if somebody's in pain, there's absolutely nothing wrong with palliating a symptom and making a symptom go away. But we want to really try to address the root of that pain. Like, why is that pain there to begin with? And so we will look at more functional causes of maybe digestion or something that may not be as obvious. Sometimes we find them and sometimes we don't. Sometimes it can be difficult. Another important thing that differentiates naturopathic medicine from other types of medicine is really trying to treat the whole person. Somebody might come into my office with a headache, but I wouldn't treat them with the same approach or with the same medicine, for example, that I would treat somebody else with a headache. The same goes with a cold or a flu. Everybody's unique and everybody needs a tailor-made treatment. So that's another big difference. In order to treat the whole person, it takes a lot longer. And so an initial visit with a naturopathic physician might take anywhere from an hour to an hour and a half to including 2 hours just to get to know the person really well, so that one can make a better determination as to whether that headache or whatever symptom is from an emotional cause, from a physical cause, from a combination. So it does take a lot longer than your standard 15-minute doctor's visit. The therapies that we employ are very different from what you get from an allopathic doctor. It's not that we will not prescribe pharmaceuticals in states where we're allowed to do that, but we might prescribe a lifestyle or a dietary change as well. One thing I repeat over and over again to my patients is that the changes that they make in their own lives go so much further than any sort of recommendation that I can make. And so really educating the patient as to why they're getting the headache, why they're getting that pain symptom, as opposed to just giving them medication for it, also goes a really long way, because you can modify your behaviors that are leading to that, if that might be a cause, or do things for yourself on a regular basis, such as eat more vegetables, drink more water. Some things are so simple, they seem like, how can that be the cause of this great problem that I'm having? And yet when we take all these dietary and lifestyle changes into account, we can see that the person's whole body, not just necessarily their symptom, but their whole body starts becoming back into balance, and they start overall feeling better. So those are the main differences between naturopathic medicine and allopathic medicine. Again, we have a lot of different tools in our toolbox, so to speak. We can employ things like nutrition. We employ hydrotherapy, which is the use of hot and cold water in specific ways. We can employ homeopathy, which is a form of energetic medicine that can help people tremendously. Intravenous therapy in some states where we're allowed to do intravenous therapy, we can do intravenous vitamins and minerals and even herbs. So we have a lot of different ways in which we can approach treating somebody, and those different ways allow us to individualize. So one of the things that I've mentioned is in the states where we're allowed to do certain things, and I want to touch up on that. There are currently 15 or 16 states in the United States that license naturopathic doctors as physicians. And in each of these states, the scope of our practice is different. So in one state, for example, in Oregon, we're allowed to do intravenous therapy. We're allowed to do naturopathic manipulation, which is similar to what you might experience at a chiropractor's office, but it's done a little bit differently. So we can manipulate the spine and to help you feel better. We can prescribe medication, and doctors who have extra training can even deliver babies. In other states where there is no regulation, such as Texas, we obviously cannot practice medicine without a license, so we don't prescribe, we don't do any sort of manipulation. Of course, we don't do any intravenous therapy, but the basis of what we do, which is to educate the patient and help them find the causes of their problems and help them take steps to change their lives, is something that we still do and works really well. So again, my name is Dr. Vanessa Fritz. I'm a naturopathic doctor and licensed acupuncturist with Austin Natural Family Medicine. Thank you.